Imagine going in for a simple routine checkup and walking out with 5 words that freeze your heart. You have prostate cancer. In that moment, the world tilts. You start Googling like crazy. One page says you'll be fine, another says you need surgery now, and another tells you about some mysterious treatment called HIFU. Your mind races, your coffee goes cold, and suddenly every headline feels like it's written just for you. For millions of men in America, that moment begins not just a medical journey, but a personal transformation. Because when it comes to prostate cancer, the biggest challenge isn't always the tumor. Sometimes it's the confusion. So today, let's cut through the noise. From PSA tests to MRI scans, from surgery to HIFU, this is the story of how precision medicine is changing everything, and what one man's 6-week journey can teach us all. 1. The first alarm. What PSA really means. Most prostate cancer stories start with 3 letters. PSA. Prostate-specific antigen. It's a simple blood test, but it can stir up massive anxiety. PSA levels can rise for many reasons. Age, prostate enlargement, BPH, inflammation, even a recent bike ride. Not just cancer. Doctors today don't look at one single PSA number anymore. They look at trends, how fast your PSA is rising, and combine that with imaging like MRI to decide whether a biopsy is truly necessary. Example: a 65-year-old man with a PSA of 5.0 that's been steady for years may not need immediate treatment. But if his PSA jumps from 2.5 to 6.0 in 12 months, that's a red flag worth investigating. Lesson: don't panic over one number. Ask for a retest, an MRI, and a thoughtful discussion before rushing into a biopsy. 2. The Gleason score. Decoding the cancer. When a biopsy confirms cancer, you'll hear about something called the Gleason score, the grading system that describes how aggressive your tumor looks under the microscope. Here's the catch. 2 men can both have a Gleason score of 7, but their cancers may behave very differently. A 3+4 is generally less aggressive than a 4+3, because the first number shows the dominant pattern. Today, many doctors also use a simplified grade group system, from 1 to 5, to help patients understand risk levels more easily. When you get your report, don't just look at the score. Ask, how many biopsy cores were positive? How much of each sample was cancerous? Is it on one side or both sides of the prostate? These details are crucial to determine whether you need surgery, radiation, or something more targeted, like HIFU. 3. Surgery or radiation. The classic dilemma. For decades, prostate cancer treatment came down to 2 main choices: surgery or radiation therapy. Surgery removes the prostate completely. It provides full pathology but carries risks like urinary leakage or erectile dysfunction. Radiation, meanwhile, targets the prostate with high-energy beams. It's less invasive but may cause fatigue, bowel irritation, or delayed side effects. Which is better? It depends. If you want peace of mind and don't mind recovery time, surgery might feel right. If you prefer a non-invasive approach and want to keep working through treatment, radiation could be ideal. What matters most isn't the method, it's the skill of your medical team. Choose experience over hype every time. 4. The rise of SBRT and IMRT. Precision in motion. Radiation therapy has evolved rapidly. Old methods required 40 sessions over 8 weeks. Now, IMRT, intensity modulated radiation therapy, precisely shapes the radiation beams to spare nearby organs. Even more advanced SBRT, stereotactic body radiation therapy, also called CyberKnife, delivers powerful pinpoint doses in just 5 sessions. Both are excellent options, but not for everyone. Prostate size, tumor position, and medical history matter. If your schedule is tight or you live far from a treatment center, SBRT's shorter course can be life-changing. But long-term follow-up data should always guide your decision. 5. Brachytherapy. treating from the inside out. Brachytherapy is another elegant solution. Doctors implant tiny radioactive seeds directly inside the prostate to destroy cancer cells from within. Because the radiation stays localized, nearby tissues like the bladder and rectum are mostly spared. Recovery is fast. Many patients go home the same day. Mild urinary irritation or temporary changes in sexual function may occur, but these usually fade over time. For men with localized cancer, brachytherapy remains one of the most balanced, effective treatments available. 6. Proton therapy. The promise and the price. If you've ever seen glossy ads about proton therapy, you might think it's the holy grail of cancer treatment. And yes, the physics are incredible. Proton beams can stop precisely where the tumor ends, reducing exposure to healthy tissue. But when it comes to prostate cancer specifically, research shows that proton therapy isn't dramatically more effective than modern photon-based techniques like IMRT, and it's often far more expensive. That doesn't mean it's bad, it just means it's not automatically better. Proton therapy may be ideal for certain complex or recurrent cases, but not everyone needs it. In medicine, newer doesn't always mean smarter. 7. HIFU, healing with sound. Now we arrive at the technology changing everything. HIFU, or high-intensity focused ultrasound. Imagine focusing sunlight through a magnifying glass. Now replace the light with ultrasound waves. HIFU does exactly that. It concentrates sound energy to heat and destroy cancer cells deep inside the prostate. Without cutting, without radiation, and usually without an overnight hospital stay. There are two main approaches. Focal HIFU treats only the affected area. Whole gland HIFU treats the entire prostate. The goal is clear: eliminate the cancer while preserving urinary control and sexual function as much as possible. Real-world data shows HIFU can offer excellent cancer control with fewer side effects, especially for men with localized, low to intermediate risk disease. Short-term effects might include mild discomfort, urinary urgency, or temporary blood in the urine, but recovery is generally smooth. For many men, HIFU feels like modern medicine's middle path, powerful yet gentle. 8. Who's the best candidate for HIFU? HIFU works best for men whose cancer is confined to one part of the prostate. It's perfect for patients who value quality of life and want to avoid the side effects of more aggressive treatments. However, it's not suitable for everyone. Men with large prostates, widespread disease, or very aggressive cancer may need a different approach. And since HIFU is still relatively new in the US, it should be performed only at centers with experienced teams and MRI-guided systems for precise targeting and follow-up. If your clinic can't show long-term outcomes, find one that can. 9. Life after HIFU, the real recovery. Most men return to normal activities within days after HIFU, but recovery doesn't end when you leave the clinic. You'll need regular PSA tests every few months and MRI scans to ensure the cancer hasn't returned. Because part of the prostate remains, your PSA won't drop to 0, but it should fall sharply and stabilize. Pelvic floor exercises and hydration can help your body recover faster. And yes, life does go on. Many men report feeling normal within weeks. 10. The SMART Roadmap. Before you decide. Here's what every patient should do before choosing a treatment path. Gather your data, PSA trends, MRI, biopsy, and full pathology report. Clarify your goals: longevity, quality of life, or minimal downtime. Ask about experience. How many procedures has your doctor performed? Get a second opinion, especially from a specialist outside your first clinic. Stay informed. Medical science changes fast. Stay updated. The best treatment isn't the most expensive. It's the one that fits your body, your lifestyle, and your peace of mind. In 2025, prostate cancer care isn't a single road, It's a crossroads. Surgery, radiation, brachytherapy, proton therapy, HIFU, each has its place. The right path is personal. It's about science, but also about you. If your dream is to beat cancer and still dance at your daughter's wedding without worrying about a little splash on the dance floor, then HIFU might just be your perfect move. And remember, the most powerful weapon in modern medicine isn't in a hospital or a machine. It's in your hands, your questions, your choices, and your courage. Because knowledge doesn't just heal fear, it restores life.